Yeah, this is an early extraction case that we did with Innovation Brackets. And I'm going to back up to the beginning of the case. We enucleated the first bicuspids. The patient had a large diastema, and upper and lower teeth were protrusive as well as having some crowding. And this is after he was leveled out. We got our double keyhole loop arch wire in the lower to close the remaining space. And you can see the nice torque control of all of the teeth. And this is after we placed the lower double keyhole loop arch wire. And I purposely did a close-up enlarging this so you could get a good view of it. You can see the elastics on the anteriors, which are used just the way you would use them on a conventional tie bracket. And this is another movie. This is not quite as good as the others, as this was done with my old video camera, which was analog high 8. But it'll show you the arch wire change, changing from a nickel titanium wire to a double keyhole loop arch wire. And of course the elastics were used to close the diastema. And of course these are just removed in the conventional manner. And this movie was made when I was first starting to use the appliance and before the art tool was available. And so I was using a tool that kind of looks like a Ward Carver. That was the initial tool that they had with these brackets. And as you can see, I'm kind of reaching around trying to find the latch on those. But even at that, it didn't take very long to open this. I think Dr. Voudouris saw this at the AAO meeting in Toronto in May, and he had timed it, and the wire change was 2 minutes and 19 seconds, even with the initial fumbling around here. And it's much less time now with the art tool, and as you gain some skill in opening the latches. Okay, and this is a real-time video, and that we didn't stop it. We just let the video run. And again, remember, I've got the camera in my view, and I'm doing this kind of blind at this point. And the biggest problem I had was just getting the arch wire through the second molar tube. And once we get that through the second molar tube on that side, we have not very long to close all the latches, and then we put elastics on the upper anteriors to close the remaining space. And it's very nice to be able to put in a double keyhole loop arch and quickly close all those latches and not have to work around the loops to tie anything, be it an elastic or a ligature wire. Okay, so once the wire is seated, then just closing of the spring clip is very easy, as you can see. And then I've included in here also the activation of the loop, bending the wire up against the second molar tube and cutting the ends off. But if you look at the time on this, you can appreciate the time savings as compared to using conventional tie brackets. And the nice thing is that we're not sacrificing torque control or the quality of the end result. Here's that arch wire placed. This is a close-up of it. So we have our upper and lower double keyhole loop arch wires. The lower is activated, and we're going to close that space first. This is after we've removed the lower double keyhole loop arch wire, replaced it with a 21 by 25 steel wire, continuous wire, and we will activate the loops in the upper and continue closing the space. And what we want is we want to keep a big rectangular wire in that lower arch until the lower canine root moves back and until we've leveled the occlusal plane. And you can see the flex in the wire there. Okay, now we have the space closed in the upper arch, and we have a 22-28 steel wire in the upper and lower. And if you look closely, I left the upper right lateral latch open so you can see the wire filling the entire slot. Okay, and we're going to let that wire sit in there for approximately 4 months in order to get our bracket expression. Again, this was not possible with the passive self-locking brackets. You've got no torque expression at this point. Look at the position of the teeth now. That's 22-28 upper and lower steel wires with just arch form in them. And here's the upper arch and the lower arch. And this is again a couple months later. This is the upper arch with a braided rectangular wire 21-25, and now we go to our short class 2 elastics. Now the current Innovation brackets have the hooks built into the bracket, so you would not have to use the tie hooks like I've used here. These were some of the original brackets and they did not come with hooks, but the current ones come with the hooks built in. Okay, and then at this point we remove the lower 21-25 steel. We go to our lower 21-25 braided rectangular. And we've got some triangle elastics in class 2s to seat the occlusion. Here's the case shortly after appliance removal. The patient will get a hinge axis positioner, but we can see we've got very good seating of the occlusion, and with the positioner that should finish it off to exactly what we'd like to have. And you can see the control of each individual tooth position on here. So all in all, as I've used this appliance, I've seen no drawbacks other than a fairly short learning curve, and I see nothing but advantages. The biggest thing is that we have a tremendous speed advantage without sacrificing the quality of the end result, and I think that says it all. If we were to multiply out the chair time savings, I think overall treatment time, maybe we save a little bit of time, but I think the most important thing is the chair time saving. If you tie arch wires a lot with ligature wire, which I do, and I think you have to do it to get a finely detailed result, that takes me approximately 30 minutes to remove ligature ties, take out the arch wire, put in the new arch wire, and tie it with ligature wire and a tie plier, cut the ligatures and tuck them in. I can do 3 upper and lower wire changes in the same amount of time with these brackets. It's 10 minutes per upper and lower arch wire change. Conservatively, I could treat 3 times the number of patients not conservatively, 3 times the number of patients possibly. Conservatively, I could treat at least 1/3 more patients in the same amount of time. And at that point, the price of the appliance becomes inconsequential, because you are going to spend so many days a week in the office, so many weeks a year, and if you have the patient demand, you could easily treat 1/3 more patients in the same amount of time without sacrificing quality. So from my standpoint, the appliance has many, many advantages and no disadvantages other than a short learning curve. So at this point, I think we can open up the meeting for any questions.